And so all of these tissues are connective tissues except E. So A is cartilage, B is fat, C is bone, D is dense connective tissue, such as you would find in a tendon, and E is skeletal muscle. Let's look for a minute at how these things that we've seen under the microscope are actually organized in our tissue stockroom, from which we can construct all the larger, more visible structures of the body. Here's our stockroom, on which we have the various tissues that we've just looked at, but organized into forms that we can incorporate into organs and organ systems. On the bottom two shelves, we have all the various ways in which connective tissue is organized to support other body tissues. We have sheets of connective tissue that we can wrap around things, such as groups of muscles. We have fatty tissue that we can use as packing material around blood vessels and for thermo-insulation under the skin, sometimes too much of it. We have cartilage and bone for the musculoskeletal system. And the cartilage that's shown is actually the cartilages of the larynx, which actually function as a musculoskeletal system. And as supporting connective tissue for other tissues in the body, we have sheets of dense connective tissue that will be used to wrap around muscles and organize them into groups. We have dense connective tissue that will form tendons attaching muscles to bone, that will form ligaments attaching bones to bones at joints. We have packing material that will go around blood vessels to fill up spaces around them between the muscles. We have sheets of insulation that will be used under the skin for thermoregulation. And we also have tubes of connective tissue that will be used to support epithelium muscle tissue in hollow organs. On the next shelf up, we have epithelium, and again, these are lining tissues, and these are also secretory cells. We have secretory epithelium. We have epithelium that will be lining respiratory, digestive, and urogenital system. We have a particular kind of epithelium, endothelium, that will be lining the insides of blood vessels. We have a roll of epidermis over on the left that will be used to form the outer layer of the skin. And over on the right, we have a kind of amorphous beaker of parenchymal cells, and parenchymal cells in any organ will be the active epithelial cells, the functional parts of that organ. On the shelf above, we have three different types of muscle tissue. All muscle tissue will have a contractile apparatus within it, and various activities of those filaments of the contractile apparatus will cause the muscle to shorten. They're most visible in skeletal muscle tissue, which is over on the left, also visible in cardiac muscle, and not very visible in smooth muscle. Then on the top shelf, we have all the wiring that we'll need for the human body. So we have a number of different types of nerve fibers. These are the actual wires that will be communicating between the CNS and the different parts of the musculoskeletal system. And then we have the neuroglia over on the right, which I've shown as a kind of insulating material to be wrapped around those wires. So this is our stockroom, and every organ of the body will use components of the stockroom to constitute itself. Here's a very simple example of how the tissues will cooperate together, of how we will take different materials from the stockroom and construct an organ. So this is actually a cross-section through an appendix. On the inner layer is a very convoluted surface of the lumen, or inside space, of the appendix, and that will be lined with epithelium, a selective barrier, a selective glandular barrier. Then just below the epithelium, again, because it's avascular, is a layer of connective tissue that will provide that metabolic support. And then layered from the center of the appendix to the outer surface of the appendix will be alternating layers of smooth muscle and connective tissue. And those smooth muscle layers will be arranged to not only cause the diameter of the appendix to get smaller, but also to contract longitudinally to move things through it. So every organ, starting with a simple organ like the appendix, will consist of usually an epithelial center, then connective tissue just below that, then layers of smooth muscle and connective tissue, and then a connective tissue layer around the outside. So just a brief look at the different organ systems. So the outer and largest organ of the body will be skin. Skin will serve a number of functions. Again, this is an epithelium with a connective tissue layer beneath it, which will be the supply route for oxygen and nutrients getting to the active epithelial cells. You notice that in the figure there are a number of red lines running around the body. As we age, we come to call these wrinkles, but they are actual features of the skin caused by the arrangement of the collagen fibers within them. These lines are shown to you here because in planning surgeries for even musculoskeletal injuries, where possible, surgical incisions are aligned or parallel with those red lines. They're called relaxed skin tension lines, or RSTLs, sometimes called Langer lines, but less accurately. And so an incision placed within them will heal more quickly and be less noticeable when it does heal. The respiratory system is a conducting portion, the airway, lined with epithelium, an exchange portion, which is the alveoli. The purpose of the respiratory system, as you doubtless know, is to enable the exchange of atmospheric gases between the body itself and the outside world. This is the digestive system consisting of a number of organs, and again, these are collaborations between connective tissue and epithelium. In the case of the liver, which is shown on the left, and for the rest of the organs, collaboration between an epithelial lining, a selective barrier, a glandular surface, and the smooth muscle and connective tissue that make up the wall. These are the organs of the urogenital system. The urogenital system consists of both the urinary system and the male and female reproductive system. We call it the urogenital system because they develop together and kind of inextricably. This slide shows the male reproductive organs, and this slide shows the female reproductive organs. The circulatory system is one that we'll be spending a fair amount of time on, and the circulatory system itself consists of a large pump in the center of the chest, arteries conveying blood away from the heart, veins conveying blood back to the heart for circulation to the lungs and then redistribution. And then a less well-known part of the circulatory system is the lymph vascular system. Lymph consists of the tissue fluid which doesn't actually return, which leaves the arteries but doesn't return through the veins and comes back through a separate set of channels. You may have heard of lymph nodes, which on physical examination your primary care physician may check. And so as the lymph is returning to the veins of the body, it may pass through one or more sets of lymph nodes. So two components of circulation are the blood vascular system and the lymphatic system. Both are important clinically, so you will see in some of the encounters between the physicians and the musculoskeletal patients that taking the pulses are important not only for overall health of the patient, but also to diagnose particular conditions of concern in relation to these injuries. The nervous system is the one the medical students like the least, but is in many ways the most important. And the nervous system is part of the musculoskeletal system. You'll see in the clinical encounters that the clinicians will be testing both sensory nerves and motor functions of nerves to see if they're intact. And pain from musculoskeletal injuries is conveyed in the nervous system. The endocrine system synthesizes and secretes hormones. So large endocrine organs include the thyroid glands, parathyroid glands, and adrenals, which are glands perched atop the kidneys. And then other organs which have additional functions as well, such as the pancreas, the testes, and the ovaries, will produce hormones also. The last of the systems, and the one that we'll be spending the most time on, is the musculoskeletal system. As you probably know, the overall basic function of the musculoskeletal system is motion. The bones of the musculoskeletal system provide a rigid framework. They articulate with one another at joints, which allow motion. So joints are also part of the musculoskeletal system. And a system of ligaments that reinforce those joints. And finally, the many muscles of the body. There are muscles of the trunk, muscles of the head and neck. I'm using striated skeletal muscles actually to talk to you right now. And then the major muscle systems of the limbs, which we'll look at in some detail. That is a brief overview of the tissues, the organs and the organ systems of the human body, and a very quick view of light microscopy. With each of the individual cases, we'll be reviewing both the tissues and the larger growth structures, parts of the musculoskeletal system, in more detail. For your last question, our stockroom is currently in some disarray. Only one of the materials shown has been correctly reshelved after a major construction project. So which of the following building materials is on the correct shelf?